To officially welcome you all and kick off Brave to Bold, the 2015 APNA conference. She began as a primary healthcare nurse and nurse manager in general practice. She's an accredited immunisation provider and has recently moved into practice management. Karen holds several committee and advisory group positions, including the General Practice Roundtable, the National Immunisation Committee, the Advisory Committee for Safety and Vaccine, and participated in several advisory groups for the RECGP, including the Pandemic Task Force and the review of the pandemic flu kit, the infection control standards, and quality health records. And I was talking to some of Karen's team yesterday. I just wanted to get a sense of who Karen is, this incredibly talented woman. And I was amazed to find out that she still is working in practice. She keeps her skills up. And someone told me, and I've got to find out if this is true. Hello, Karen. You're still working in practice currently, yeah? Is it true that a little while ago you were doing data entry at your practice 2 days a week, like sitting in a computer and doing data entry? Is that correct? Some time ago, okay. So she was sitting there doing data entry, very qualified professional woman sitting at the computer because it needed to be done. And someone said, oh, I wonder if she can do, immunisations. And of course, you're qualified, so Karen started doing the immunisations. And they went, oh, what if we need someone to do the wound care? Obviously, you know how to do the wound care. Can we get someone to do the health and welfare advice? And can we help someone to, manage chronic diseases? Karen stepped up. She did all of it. And I guess the thing that really stood out for me, Karen, is right now our country needs you to be doing what you're trained and qualified to be doing. We don't need you sitting at a computer. We need you keeping people out of hospitals. Am I right? Yes, so that's what we need you to be doing right now, my friend. Ladies and gentlemen, would you please welcome to the stage the most overqualified data entry operator in the world, your APNA president, Karen Booth.
Thank you, everyone. And before I begin, I'd like to thank Luther for that very warm welcome to country. And on behalf of APNA, I too would like to recognise the traditional owners of the lands and seas that we are meeting on today. I'd also like to pay my respects to elders past and present, and I warmly welcome any Aboriginal and Torres Strait Islander people here with us today. Moving on. Good morning, everyone, and welcome to the Gold Coast, this our 7th national conference, where together we are making the step from brave to bold. I extend a warm welcome to our dignitaries. We welcome the Minister for Health, the Honourable Miss Sussan Lee, and we appreciate the Minister showing her support for primary healthcare nurses and being with us today in what probably could be considered the busiest week in Parliament. So, Minister, welcome. We welcome the Commonwealth Chief Nurse, Dr. Rosemary Bryant, Chief Nurse and Midwifery Officer, and we're very much looking forward to Rosemary sharing her story from brave to bold with us today. There are a number of other dignitaries here from the Commonwealth Department of Health. Karen Cook and Alison Simpson are in the crowd somewhere. Welcome to you as well. We are delighted to have attracted such a wonderful array of international and homegrown speakers who will contribute to the Brave to Bold program over the next few days. We're very much looking forward to you sharing your stories, your teaching and your knowledge about primary healthcare nursing, and I welcome you all. The theme for this year's conference came from our APNA Strategic Planning Day, where the board had reflected on the enormous growth and change and the development of our organisation over the past 2 years, and as well as significant developments in the role of primary healthcare nursing. And we could see the progression from the previous strategic plan, which at the time APNA considered to be brave. We looked at the increasing sophistication and the cutting-edge approach that APNA has adopted and could see that we were now indeed moving upwards from brave to bold. Primary healthcare nursing is one of the fastest growing areas of nursing in Australia. There are approximately 39,000 nurses working in primary healthcare, with more than 11,000 of those working in general practice. We are seeing nurses moving from the tertiary hospital sector into primary healthcare nursing as they seek experience in longer-term continuity of community-based healthcare. I myself moved into general practice after years in emergency department, paediatric ICU, and then a brief stint as an academic. And what we know is that these nurses, like most of you here in the room, bring a rich and high level of skill to the primary healthcare setting. We are also seeing greater numbers of new graduate nurses choosing to make primary healthcare nursing their first career choice. Exposure to primary healthcare nursing in the curricula is improving, and APNA is connecting with students and working with universities to promote primary healthcare nursing as a viable and compelling career choice. We know that nurses in general practice need some additional support to ease into their new role, and APNA is developing that support. The rise in the demand for nursing services is driven by the recognition and the benefits that nurses bring to the healthcare teams and the demand by health consumers for services provided by nurses and a greater options in healthcare choices. These benefits include the adoption of cost-effective, flexible and multidisciplinary approach to healthcare. We know that 1 in 2 Australians has a chronic condition, with 1 in 4 having at least 2 chronic conditions. Cardiovascular disease, mental health and musculoskeletal conditions account for approximately 25% of the Australian health budget. The number of Australians with dementia will reach almost 400,000 by 2020 and 900,000 by 2050. Strong primary healthcare systems are ultimately the answer to Australia's looming healthcare crisis, yet these systems are under significant stress. Access to care is becoming increasingly problematic as demand rises, and some practices, many in rural areas, are already having to close their lists to new patients, forcing people to seek care in the more expensive emergency department and casualty-based clinics. How do we, as a nation, both contain and manage this, whilst most importantly, maintaining quality and safety of the care that's being delivered? The solution lies in primary health care, delivered through general practice and other community-based services. Nurses are key to that upstream approach to healthcare that is good quality screening, preventative care, coordinated care to reduce the risk and morbidity that comes at a high cost to the patient, to their family, and to us as a country. We know that chronic conditions are placing significant demand on our health resources, and as primary care nurses are central to that response. Those 39,000 nurses that I mentioned earlier are spread across almost every local community in the country. Nurses are already well positioned as care innovators, patient educators, problem solvers and agents of connectivity, and we all know that phrase, the glue that binds it all together. Nurses are a highly respected group of health professionals. There is a strong recognition that nurses are vital to the provision of high quality, local, accessible care that contributes to improved health outcomes for their patient populations and reduction in hospital admissions. There are nurses here today from every state and territory, from the most remote to the inner city, which reflects that we, APNA, truly are a national organisation. You, the nurses in this room, are strong and capable workforce who will take back knowledge and skills that you've learned over the next few days to your local communities. I see this conference as the hub of innovation for primary healthcare nurses in Australia. We have also seen a sharp growth in the demand for primary healthcare nursing input into health committees and advisory groups, not just in their local community, but also at high state level and federal health committees. We've seen a growth in the number of members supported by APNA, leading the way and putting their hands up and utilising their expertise as evidenced by the large number of committees listed in our annual report this year. And if you haven't seen it, I suggest that you seek a copy and look. Okay. We want to see more nurses moving from brave and pushing forward to be bold. Offer your skills and nursing view as we see these new primary healthcare networks setting up. Nurses know the practicalities of how health programs are implemented on the ground, in their workplaces, in their clinics, and dealing with real people, our patients. And to see more nurses participating in that helicopter view of governance and sharing their knowledge at high-level health policy development. We also wish to thank the Minister and the Department of Health for the support they have shown investing in the current work of APNA, the Nursing in General Practice program, to support the nursing workforce to deliver best practice high quality healthcare. However, we also know there is more work to be done. I'm proud to lead APNA as our profile continues to evolve into a flexible and nimble organisation. APNA is the peak body representing nurses in primary healthcare and continues to support the primary healthcare nursing workforce with high quality professional development, advocacy, and actively driving contemporary models of primary healthcare nursing. APNA will continue to focus forward and move from brave to bold to help achieve our vision of a healthy Australia through best practice primary healthcare nursing. We wish you an enjoyable 2 days at our conference, and we wish you all the best on your journey from brave to bold. Now, I would very much like to welcome the Minister, the Commonwealth Minister for Health, the Honourable Ms Sussan Lee, to the stage. The Minister has a very personal connection to nursing. Her mother is a nurse, and we welcome you into our fold. And you're in a room full of nurses, and yes, someone may attempt to mother you. They do that. In our previous meetings with the Minister, I was impressed with her willingness to listen and to consult. Please welcome the Honourable Ms Sussan Lee to the stage. Thank you.
Thank you very much indeed, Karen, and to you, to Julianne, your Vice President, to Rosemary, the Commonwealth Chief Nurse and Midwifery Officer who will be joining you shortly, and to the participants, particularly that have travelled from overseas. It's lovely to be here. Can I acknowledge the traditional owners and pay my respects to elders past and present, and say that as Australia's Health Minister, I absolutely understand that the health of our first Australians is inextricably linked to their connection to country. It's just a few days since the Treasurer delivered his and this government's second budget, and only a few weeks since I announced some important initiatives to reform and update Medicare. These initiatives are common sense. They're overdue, they're well supported by medical and health professions, and in building a better Medicare system, I want to see one that's sustainable for the long term. The latest intergenerational report from the Treasury predicted that Medicare would be the fastest growing element of government health spending in coming decades. In fact, our health spending in Australia is growing much faster than that of other countries. when I hadn't been the health minister for very long, I met an earlier health minister, Michael Wooldridge, and he said to me, you know, the average term of a health minister in Australia is about 20 months, so if you want to get on and do something, you may as well hurry up. So maybe I need to be brave and bold. I like the theme of your conference. And I very much like your comments, I must say, from the nurses at the beginning. I was very pleased that all the glasses were full. I was a bit worried there was a couple of empty ones at the beginning. But to capture, I think, what everyone said, it was very much about you as nurses are here for the whole patient and the whole patient journey. And as the minister and as the department and as the colleagues in the Parliament, and I always say ministers come and go, but the system has to be robust and strong. What we must do is make sure that we don't hone in on different aspects of the system without seeing it as a whole and without realising that patients don't see it like that. They get sick, they go to a doctor, they go to hospital, they come back out, maybe they go back in again, they go back into general practice and so on. And there's all this sort of complicated different funding streams and 2 levels of government that manage it. So we have got work to do and we have got improvements we can make. We are taking a consensus approach. I know that's an overused word in politics, but we don't need opposition for the sake of it. Every one of us is a customer of the Australian health system, and every one of us gains when our health system is working the best it can. There's no doubt that you as primary healthcare nurses will be important players in the changes that will follow the reform process as it unfolds. So let's look at some numbers. In the last 10 years, the number of nurses working in general practice has doubled. More than 12,000 nurses now work in general practice, and around 2/3 of practices employ at least one nurse. Practice nurses now account for almost 1 in 3 nurses in primary care, who total, I'm told, around 39,000. And primary care nurses, in turn, comprise well over 1 in 8 of all nurses in health services in Australia. Universities have recognised these changes and shifted the focus on undergraduate nursing courses to include more content related to primary health care rather than acute care nursing. The Australian Government has also, for more than a decade, recognised the potential of nurses to provide primary healthcare services. In fact, it was Tony Abbott, as Minister for Health, who introduced the first Medicare items for services by nurses, and they related to wound care and immunisation. That was in 2004. He later expanded the number of Medicare nurse items and extended the incentive scheme for GPs to employ nurses to hundreds more practices. Today, the professional capacity of primary healthcare nurses is supported by the Nursing in General Practice program, managed by the government, for the government by APNA, and the Practice Nurse Incentive program, which provides assistance for general practices and Indigenous specific medical services to employ nurses and allied health professionals. So nurses are making a major contribution to primary health care, and your role will only increase under the reforms that I have announced. These reforms to Medicare are genuine and are aimed at improving the operation of Medicare and quality of health care for patients. I'm determined to work hand in hand with health professionals and patients to ensure that Australians receive high quality and appropriate care as efficiently as possible. The 3 priority areas for reform are based on the feedback I received during months of consultation. They reflect first and foremost the obvious need for our health system to adapt to modern patterns of ill health, with chronic disease now the major problem we face. Chronic diseases like diabetes, cardiovascular disease, asthma, cancer, musculoskeletal conditions and stroke can, as you all know so well, have a huge impact on sufferers and their families. They make it hard to stay active in employment and in the community, damaging prosperity at the household, community and national level. As a group, chronic diseases are now the leading cause of illness, disability and death in Australia. The surge in the incidence of chronic disease has been a factor in pushing up the cost of Medicare, which more than doubled from about $10 billion to about $20 billion over the past decade. The need to do better for patients with chronic and complex conditions is therefore a major theme of our Medicare reforms. So first, a review of the Medicare benefits schedule. The review will be done by a task force led by the Dean of the Sydney Medical School, Professor Bruce Robinson. Currently, the MBS has more than 5,500 services listed. The review will eliminate out-of-date, ineffective and even harmful procedures and recommend ways to align services with contemporary clinical practice and evidence. Secondly, an advisory group led by former AMA President Dr. Steve Hambleton will investigate options for better primary health care. It will specifically look at better care for people with complex and chronic illness, innovative care and funding models which recognise the ongoing needs of those patients, better recognition and treatment of mental health conditions, and greater connection between primary health care and hospital care. Thirdly, the government will work with health professionals and consumer representatives to develop better rules on the use of Medicare. In each reform area, I will be looking for guidance and input from everyone who is active in the health environment. I encourage APNA and all of you here today to add your expertise to this process over the next few months. I've asked for a report back on each of the 3 priority areas for action later this year. I'm sure that as frontline service providers, you understand exactly why change is needed. We need better funding models for regular patients with chronic conditions. It makes sense to explore a blended model of payment where perhaps a general practice receives a block of funding from the government to care for the particular patient, but there is also some fee-for-service funding. And this is not, of course, a new idea. It's already happening in general practices now to some extent. Primary healthcare must also become more relevant to the needs of current and future patients. It has to be more effective in promoting health and preventing disease, more coordinated with other health services, more consistent in quality, better targeted to groups at risk, and more efficient at every level. It should be heavily focused on keeping Australians well and out of hospital, and aged care facilities should be there, but Australians should be healthy and happy in their own homes for as long as possible. You, as skilled primary healthcare nurses, will be crucial to achieving these goals. Now, the other big reform that we are using to collectively reach these goals are our primary health networks. It's only a matter of weeks until the Medicare locals transition to PHNs starting on July 1. PHNs will receive funding of approximately $900 million from the government over 3 years. They will concentrate on 6 key priority areas: mental health, Aboriginal and Torres Strait Islander health, population health, health workforce, e-health and aged care. A key difference between primary health networks and Medicare locals is that the primary health networks will focus on improving access to frontline services. A little bit invisible behind the scenes, working with general practice, working with you, working with all of the organisations that already exist in their population base, not recreating what is already being done in general practice. They will have GP-led clinical councils and community advisory committees to keep them focused on the needs of the communities within their boundaries. A number of the consortiums which have been selected to run the PHNs through a tender process include some of our more successful former Medicare locals. Many of them harness skills and knowledge from a range of sources, including allied health providers, universities, and even private health insurers. The PHNs will work directly with GPs, other primary health care providers, secondary care providers, hospitals, and the broader community. Aligning the PHNs to the state local hospital networks will help to reduce this merry-go-round for patients with chronic or complex conditions between primary care and hospital treatment. And while the PHNs will work at the local level, we also need national and state level direction to enable us as a nation to turn around the growth in chronic disease and their risk factors. Work is currently underway to develop a new strategic framework for chronic conditions, replacing the 2005 National Strategy. This new framework will recognise the links between national and state-based chronic condition strategies and will reflect shared views on priorities and how they should be addressed. It will provide a modern policy model which can easily incorporate new evidence and will provide another opportunity to consider how best to deliver coordinated, integrated and multidisciplinary care. We're also developing a separate national strategy for tackling the epidemic of diabetes. which is now estimated to contribute to about 1 in every 10 deaths and likely to rise sharply in the future. Public consultation on the National Diabetes Strategy is about to end, and we're going to release the final strategy before the end of the year. I was at a roundtable of allied health professionals recently and was told that we have the second highest rate of diabetic amputations in the world, which is an alarming statistic and one which I certainly don't think we can accept. Your workforce. Your involvement continues to grow, both in terms of the number of nurses working in the area and the number of patients with or at risk of diabetes that you care for. I should also note briefly that the government is continuing to support the popular Mental Health Nurse Incentive Program in 2015-16. It will ensure service continuity for over 54,000 people with severe and persistent mental illness living in the community. Overall service levels will be maintained at up to 165,000 sessions, and this will assist GPs and psychiatrists' support to this important client group. My department has now advised peak bodies and key stakeholders of this, and the Department of Human Services will shortly be notifying participant organisations of the 2015-16 arrangements. Having seen a lot of mental health nurses working in primary practice, I was very determined that we continue with this successful program, and I notice you've got some discussions on your program about so much anxiety, depression and other mental health conditions presenting in the ordinary course of the things that you do. And the nurse model, mental health nurse model in general practice, in my view, works incredibly well because the patient is there for the other reasons that they're there, and somebody will say, look, just pop in and see the mental health nurse, or perhaps see the person by name rather than giving them that title, and they can therefore operate in so many different ways across the patient community and the patient's families. Now, the latest update report on Australia's future health workforce predicts significant shortages of nurses over the next 20 years, although I understand that the number of graduate nurses in their very early stage of their career is at high numbers. When I talked about this with the College of Nursing, we discussed the possibility of the government support in the way of scholarships being directed at those first-year graduate nurses. So I quite like that idea. I've talked to Rosemary about it, and we might work up some further models, because it's important that nurses in that very early stage, when they do need intensive support and mentoring, so they don't end up being frightened away from the hospital system or indeed the primary care system, and they have confidence to undertake the next stages of their career. So I look forward to APNA's input on that. It's important to attract more people, women and men, into nursing and to retain them. But while doing this, we have to maintain the quality of training and the affordability of care. So I very strongly support the involvement of nurses in primary health care, and I believe your role will naturally increase as Medicare and the primary health system are reformed and modernised. So please be reassured. I will continue to consult with you every step of the way, and your organisations will be represented on the various bodies that actually change policy and make a difference for the future. I met with a group of nurses recently who said, you know, you sit down and talk to doctors, but if you sit down and talk to a group of us, you will find out exactly what's going on in the system. So sometimes what I do is somebody contacts me out of the blue, and I sit down and have a cup of coffee with them, and I find out exactly what's going on. So I'm open to those invitations, because they do inform in a really positive way the things that we do. Can I just say lastly, again, thank you for being here. I was invited to by another allied health group who came to see me yesterday, and they said, we'd love you to come to our group. We're in Canberra in August. And I said, I can't believe I could be in Canberra in August. But to be on the Gold Coast for you is fantastic. I'm just doing a flying visit. I'm going from here to Brisbane, so excuse me for leaving straight away. And then I'll get home tonight at about 9 o'clock, so I'm very excited about that after Budget Week. My electorate, so none of us as members of Parliament can possibly not give the areas that we represent a big plug, is Western New South Wales, including the Murray and Darling rivers, and it's about a third of the state. And because everybody in Australia lives on the coast, we are getting larger in the areas that we represent, and if I can your practice is, for those of you who work in regional, rural and remote Australia, you probably experience the same thing, having to travel longer distances, having to do more over greater geographic areas. So at the next election, I will be standing on it's quite likely standing on the ridgeline of Mount Kosciuszko and looking to the Queensland border and quite a lot of the country in between. So I'm very grateful that in an early career as a pilot, I'm able sometimes to fly myself around. So just a last plug for rural, regional and remote communities and the work that you do in them, and the really, really important role that an integrated allied health approach has for all of our Australians who don't necessarily have the advantages of living in the city. So thank you again for having me. Thank you, Karen, for the amazing work you and your team do, and enjoy the conference.
Lovely. Thank you, Minister. Thank you, Karen. Karen, did you want to say anything further, or yes? Okay, take it away.
Really wanted to extend again our thanks to the Minister for giving us this time and sharing this time with our organisation on the Gold Coast, given that we know the amount of commitments that you have. So thank you again to the Minister, Sussan Ley. Thank you.
Thanks, Karen. Thank you, Karen. Thank you, Minister. Now, Minister, you sure you don't want to stick around for a coffee? There's 400 people here that would love you to have a coffee with them, and I'm sure you could just clear your schedule for the rest of the day, stick around with us. We've got a Boldlywood night tonight. What's your Indian dancing like? What do you like at patting the dog and screwing the light bulb? You can do it, Susan. I can imagine you can do it. Thank you both very much. Our next guest has had a long and illustrious career in nursing. She's also consulted to the World Health Organisation, was recognised as a Fellow of the Australian College of Nursing, made an Emeritus Director of Nursing at Royal Adelaide Hospital, and was awarded the degree of Doctor of the University by both my old uni, QUT, and Flinders University. Today, in addition to holding the Order of Australia, the title of Australia's first Commonwealth Chief Nurse and Midwifery Officer, and, excuse me, something happened, and the 26th President of the International Council of Nurses, she advises the Minister for Health and the Department of Health and Ageing on a range of nursing and midwifery issues. She's quite the underachiever. Would you please welcome Dr. Rosemary Bryant, AO.
Thank you very much. It's lovely to be here with you all again. And perhaps I could just start, though, with acknowledging the traditional owners of the land upon which we are meeting today, the Bungaree people, and pay my respects to the elders past and present. And I would also like to extend this respect, acknowledgement and welcome to other Aboriginal and Torres Strait Islander people who may be attending today's event. So I would like to thank Karen Booth and Alexis Hunt for inviting me here today, but I'd also like to acknowledge you, Minister, the Honourable Sussan Ley MP, Minister for Health and Minister for Sport. It is a real pleasure, though, to be with you again today. Some of you will recall, possibly only a few of you, that my association with nurses working in general practice started in 2001 when we had a budget initiative. Well, I wasn't working in the Commonwealth then. There was a budget initiative to initiate the set up the first nursing in general practice program. So when Karen was speaking earlier, I was reflecting how far you had come since that time. And there's Liz Medley nodding her head, and Lynn, who is a couple of the originals, shall we say. So it's really nice, though, again, to be here, given that this is my final APNA conference, because I will be relinquishing my position very shortly. I was invited to speak on leadership and advocacy, which in many respects can be transmuted into this year's conference theme of brave to bold. One must be brave, of course, to be a leader, and be bold to harness advocacy. And by advocacy, which is the word advocacy and the actions associated with it are no stranger to us in this room, because I think from day one we are taught about patient advocacy in particular. But I'm referring to various types of advocacy, for example, for our patients, the profession, and ultimately for change. So I have been running around the country a bit with, particularly just having been International Nurses Day and having given a number of presentations. So I was sort of reflecting on my past, and I have been reminded of my own audaciousness in line with this theme, which I think was considered rather bold. When I began my nursing education in 1963, and it was in Queensland at the Princess Alexandra Hospital, it was compulsory, of course, to live in the nurses' home, and the attendant rules associated with living in I felt very petty and constraining. As a result, people said to me, do you remember the first matron, so on and so forth. I knew her very well, because I was frequently in her office, always in trouble, always doing something that wasn't quite right. But the misadventures were there, but it also, when I think back, it was also about a lot of my carry-on was about patient advocacy. So, I started young, shall we say. Bravery and boldness, though, are core traits for future leadership and advocacy within our profession, and which ultimately culminate in changes within the broader health care system. And both Karen and the Minister have outlined some of the many changes that have taken place over the last years and the changes that are in the system to come. Change, of course, is absolutely necessary. And some of you may know this quote, but I will repeat it. As Florence Nightingale said, unless we are making progress in our nursing every year, every month, every week, take my word for it, we are going back. One of our greatest challenges, and again Karen alluded to this, is achieving change is learning how to be leaders at the policy level. Too often we're not present at the levels where policy is formed. To influence policy at national and international levels, nurses and midwives need to develop leadership and advocacy skills, bravery and boldness in today's terms. These skills include lobbying, critical and strategic thinking, and effective communication, as well as knowing how to negotiate and form strategic partners and alliances. If we're not at the policy table, we will face barriers to access for resources to do our work and improve access to healthcare for our patients. And I am reminded by this comment, by the work done in the United States by the American Nurses Association, who partnered with, and I can never remember the name, but partnered with a patient advocacy organisation, and together they were a real force in achieving the passage of the Affordable Care Act in the United States. So that to me is a really good example of how strategic partnerships can be for the good. But as nurses and midwives, we are in a unique position to understand the health context from the service delivery setting to public policy formulation and implementation. There is a great need to fulfil the growing stakeholder demand for nursing and midwifery input and leadership. So as part of this, we must nurture future leaders and foster confidence amongst those able but inexperienced in the planning and policy arena. Strengthening leadership in nursing and midwifery is vitally important so that we can meet our professional obligations to identify and lead positive change throughout the entire healthcare system. I think that this will require an honest and inward examination of how to support leadership development within nursing and midwifery. A couple of weeks ago, I was invited to speak at the Jordanian Nursing Council's 5th International Conference, and I began my presentation with a quote from Carleen Kerfoot, a well-known nursing academic. In her article, The Leader as Synergist, Kerfoot says, and I quote, "A leader cannot provide direct care. A leader must work through others to accomplish the work, but the leader is only as good as the people who are providing that care. The leader's obligation is to create the environment in which good people can provide good care." And I end the quote. The crux of that quote, for the purposes of today's presentation, lies within the last line. The leader's obligation is to create the environment in which good people provide good care. Some years ago, when I was a director of nursing, and was mentioned actually in my introduction, as it happened, at the Royal Adelaide Hospital, I was often asked why I had, in inverted commas, abandoned clinical practice for nursing administration. My response was always that, being very familiar with the frustrations and obstacles encountered by nurses and midwives at the bedside, my main purpose as a nurse administrator was to support those who were delivering the care, because I understood the environment so well. And a director of nursing is in a very powerful position to do that. I suppose that's my roundabout way of saying that leaders are not only capable of influencing an environment conducive to high quality care, but they also have the capacity to shape the policy to create the very environment and health system in the first place. Just for a moment, let's consider the changes within the profession that we've witnessed because of the brave and bold leaders who've come before us. In Australia, for example, we have seen nursing education transferred to the tertiary setting, and of course we were the first country in the world to do that. We have also seen nurse practitioners and midwives who work at an advanced level being able to provide services under the MBS and prescribe under the PBS, and I'm sure we'll see more changes in that arena soon. And particularly relevant to today's audience, the Practice Nurse Incentive Program, the current one, provides incentive payments to practices to support an expanded role for nurses working in general practice. And of course, in July, in 1st of July 2010, the National Registration Accreditation Scheme for Health Practitioners was established by the state and territory governments, and that was a really, really large and important advance. And the nursing profession in particular started the lobbying for that change in 1988. So from 1988 onwards, we were working towards that a national scheme, and of course we were told constantly, the Constitution doesn't allow, it's not going to happen. Well, it did happen. So it's a very good example of, tenacity and being brave and bold and getting there. And they were not, all of these changes have not come about in a vacuum. They were and are directly correlated to the brave and bold people who lobby and advocate and lead. But I would also encourage you, in concluding, to be bold and brave and be plucky and courageous and be a nuisance, as I was, absolute nuisance. I'm sure they were very pleased when I departed from the Princess Alexandra Hospital. Mind you, I was invited back there. I was there only on Tuesday this week, and they gave me a framed copy of my training record, and I have to be very frank with you. I have been busy. I got back from Brisbane on Tuesday night for budget night. I was in the office Wednesday, and I came up here yesterday, so I've been very busy. I haven't unwrapped it yet. I'm not game enough, actually. Well, I will be when I have a cup of coffee and I'm relaxed. Perhaps I'll look at it. I know it'll be awful. But, I haven't done too badly given that, shall we say. But it's also, just to finally, it's only when voices are heard loudly and clearly and in a chorus, the very important, I could go on and on about that, but I won't, in a chorus, very important, working together, that we are able to bring about change within the profession. So I wish you well for the conference. Program looks great. And once again, thank you all very much for inviting me. Thank you.
Lovely. Thank you so much, Rosemary. And I believe, Julianne, you've got a little gift.
Yes, just very briefly, Rosemary. I certainly related to some of Rosemary's stories. We go back a long way, and I spent a considerable amount of time in Rosemary's office also. And I might just say, at the end of my training, she didn't invite me back. My first year as a graduate nurse was spent elsewhere. But here we are today. Well, I've done pretty well. Yeah, you did all right too, girl. So, Rosemary, just a small token from APNA. We know that APNA will be in your heart. Yes. And Liz Medley will tell you, we don't let go of people that say they're retiring. So, we'll keep you in our fold. Thank you so much for what you've done to nursing. You have touched every nurse's heart in Australia.
Oh, no, that's a bit much.
No, I truly believe that. Thank you. You're our first Chief Nurse and Midwifery Officer. We love you and have a great retirement.
Oh, beautiful, Julianne. Beautiful. Beautifully said.